Welcome to AT&T's teleconference service. Please enter your access code, followed by the pound sign. Your access code was not recognized. Please re-enter your access code, followed by the pound sign. Your access code was not recognized. Please re-enter your access code, followed by the pound sign.
Good afternoon, everyone.
Good afternoon.
Good afternoon.
Good afternoon, Madam Chair.
I would like to go ahead and call the meeting to order. Mr. Gilbert, would you like to take roll call?
Thank you, Madam Chair. I'd be delighted. Chairman Jameson.
Here.
Thank you. Dr. Grinstein is absent. Ms. Lewis?
Present.
Thank you. Ms. Wilson? Ms. Clark?
Present. Sorry.
That was a good one. There you go. Mr. Melendres? Present. Thank you. Ms. Ritter?
Present.
Mr. King?
Present.
And Ms. Reynolds?
Present.
Thank you. We have a quorum, Madam Chair.
Very good. I would like to go ahead and call for public comment. Is there anyone in Reno for public comment?
No public comment in the north, Madam Chair.
Do we have any public comment here in Henderson? There is no public comment here. So we'll end public comment and go on to the approval of the minutes for February 11th, 2016. Do I hear a motion to approve?
Motion to approve the minutes?
Valerie Clark, for the record. I make a motion to approve the minutes.
We have a first by Jose Melendres and a second by Valerie Clark. Is there any discussion? We then go ahead and everyone in favor of approving?
Aye.
Thank you. The February minutes are passed. Our executive director report, Mr. Gilbert.
Thank you, Madam Chair. Bruce Gilbert for the record. You know, when last we met, I shared with the board that a lot of our time over the upcoming months was going to be dictated by the final notice of benefit and payment parameters when issued by CMS. And that rule was issued finally on February the 29th, and as expected, sets user fees for state-based marketplaces such as Nevada, which utilize the federal eligibility and enrollment infrastructure. That fee was set at 3% of the pre-subsidized premium generated by QHPs and standalone dental plans sold through the exchange. However, the rule also sets a 1.5% fee for 2017 as a transitional year and indicates that CMS intends to annually review the fee charged and will adjust it as it deems appropriate. Now, even at 1.5% of premium, the cost of remaining on the federal infrastructure in 2017 is expensive. It's over $4 million. That figure represents about 47% or so of the annual revenues of the exchange for that year, as we project them to be. And I know it says will in my report, but the truth is it could require a reduction in the historical level of spending on consumer education and outreach, our Navigator program, and marketing. I would share with the board that I spent some time this morning with our chief financial officer and have been assured that as we have been good stewards of our money, between our reserves and the revenues which we will take in 2017, we have the luxury to decide, based on our interests and the timing that we believe appropriate, how long to remain on the federal system, including 2017. We can afford to do that if we wish. As I've made clear before, staff believes that there are commercially available, proven, and less expensive alternatives to the federal technology platform and call center that would both lower our technology costs and provide us with ad hoc, real-time reporting, and would allow us to better target our marketing and messaging. We'd also have the ability to provide better customer service and certainly a less bureaucratic appeals process, reducing decision time and making sure that our consumers are treated fairly. Our intention is to continue to collect information on these alternatives, and we anticipate providing additional detail to the board at our April meeting. I understand the timeline for 2017 is clicking past very quickly, and a decision will have to be made shortly. But we want to be able to take the time to take a look at what's out there and recommend to the board whether we believe it to be in the best interest of our consumers to remain associated with healthcare.gov for the 2017 plan year. And we'll deal with 2018 a little bit differently. And also propose a process for choosing an alternate technology platform and managing a transition in the event the board determines a move to be the best path forward. One of the points that we've tried to make over the course of the last several months is that technology and exchange are not synonymous terms. Technology is one of the tools that we use to further our mission, but it's not the only tool. And in my opinion, we cannot afford to spend lavishly on technology and cut back on those functions and activities that have proven successful in driving enrollment to record levels each of the past 2 years. And my sense is that the board agrees with that sentiment. I will share with you, having come from private enterprise, that I would never allow my business to spend more than 35% on technology and tools. It's not where your money goes. You need to be able to do marketing. You need to be able to have appropriate people in appropriate positions. And if you're spending 50 to 80% of your money simply on technology and call centers, you cannot do what you're supposed to do. Additionally, and this is not something we've talked about before, the exchange is in the process of revising our brand standards and associated policies. The original branding standards, while appropriate when they were conceived and implemented, they've proven to need adjustment as the number of brand partners that we work with has expanded and our name and logo have become more widely recognized. In order to minimize issues arising out of the policy revision, we chose to wait until after the conclusion of the open enrollment period before beginning the transition process. However, with the enrollment period for plan year 2016 having come to an end, the time has come to begin implementing the new standards. To that end, and as a transitional activity, any and all consent previously provided for the use of the Nevada HealthLink name and logo has been withdrawn. While the brand standards are in the process of revision and pending the provision of additional information, we're working on a policy to govern approval of requests to use our name, mark, and logo going forward. Any persons or entities wishing to use or continue to use the Nevada HealthLink name or logo must submit a formal written request for such use and provide detail as to the name and logo and how they are proposed to be used. Our name and logo will not be placed in or used as part of a third-party press release, website, on social media as a product flyer, or in promotional literature without our review of that specific release, website, flyer, or literature and our express written consent. Our name and logo will not be used by any entity or person not certified by the Silver State Health Insurance Exchange to sell health insurance plans through the exchange. And finally, we've reserved the right to prohibit any use of our name and logo if we believe that usage is misleading or could discredit the HealthLink or tarnish our reputation and goodwill. The moving force behind this is we've received a number of consumer complaints, most of which deal with insurance agents, no offense, on the internet, whose websites indicate that individuals are signing up for coverage when in fact that information is taken and utilized by those agents or brokers or others, and non-exchange products are sold. We've received a number of complaints from consumers. We recognize and understand this to be an issue, and we intend to take steps to protect the consumers of Nevada. This is the very first step in that. We will be working over the next month or two with our Deputy Attorney General and others to revise the brand standards so that we can make certain that there is no opportunity for anybody who sees the Nevada HealthLink name or logo not to understand what they're dealing with. And so that's important to us. The revision of the brand standard and the associated policies really marks the further evolution of the exchange as an ongoing entity. We're not a startup anymore. And over the last 2 years, our brand, which is our identity, has been relentlessly communicated. It's defined our approach to marketing, to operations, and more. And it's reflected in our website, in signage, our social media messaging, and face-to-face conversations. The first year wasn't an asset. It's an asset now, and we have to guard against its misuse or imitation. The next few months are going to be a very busy time for the exchange and for its staff. With a number of important decisions looming on the horizon, I am confident that the board will review these issues, these questions, these things that they have to consider, and base their decisions on protecting the interests of our consumers and stakeholders and assuring the exchange will be able to continue to provide access to quality, affordable health plans to Nevadans throughout the state. Madam Chair, those are the sum and substance of my remarks, and I'm happy to answer any questions that you or any other member of the board may have.
Thank you, Mr. Gilbert, for that executive report. As always, thorough, so informative and up to date. Do we have any questions or comments regarding Mr. Gilbert, our executive director's report? Ms. Clark?
Yes, thank you, Madam Chair. I just want to be clear on the technology that we're reviewing. We are looking to make a change before open enrollment starts for the 2017 open enrollment. If we do.
Mr. Gilbert, would you like to go ahead and take that question? Since I think it's still
Thank you, Madam
somewhat
Chair.
decided, but up in the air
I
a little
don't
bit.
think that we have determined whether that's the path that we want to take. Whether 2017, because of the short runway and the issues that we face in making that type of transition, it makes it impractical or less attractive than taking the longer range approach and doing it in 2018. So I don't think it's a question of, are we locked in on 2017? Because I don't think that we are. But I do think that we need to look at what makes sense for us, given our history and our transition, and where we ought to go.
Thank you. I just know, as a broker, we struggle tremendously with the amount of customer service and the amount of help that we can provide to our clients on the federal exchange. We can provide very little. So, speaking as a broker, we would love to see something more broker-friendly for 2017.
Ms. Clark, that is so, it's very informative for us to hear that back as a broker, because I did not realize that it was at a significant level that you were experiencing issues with the federal hub. I think that Bruce will address this better, but when we attended, and it was so gracious of you to spend your time attending some of the meetings with the potential new vendors. And when you and I attended it, we did note that from their end, it is a reality that they feel they could get us up. But as I think our executive directors pointed out, we still haven't completely vetted everything out. And I think with our history, it's imperative that we not be fools rushing in. I think we found undoubtedly some excellent programs we could sign up with today and probably get on board by 2017, but I think Bruce could speak to this better. At this point, we're trying to vet out if there are collaborations that we could be a part of that would even be better than acting alone. So I think there's just more complicating issues, and I think that's probably why it's possible we will not be doing this year. But Bruce, would you like to address that?
Yes, thank you, Madam Chair. Bruce Gilbert, for the record. One of the things that I would point out is when we talk about the customer issues that our brokers and agents face, and I understand them all too well because we work with you with regard to those, the issues are not with respect to the application and enrollment process so much. The problem is once you get past that, if you have a consumer who has an issue or a problem, you enter into this bureaucratic maze where documents are lost and customer service is not very good. It's unwieldy, it's difficult. And even with our intervention and our contacting CMS on behalf of brokers and on behalf of consumers, we have as much trouble, frankly, as anybody else making progress in that regard. That's probably one of the primary dissatisfiers. The issue is not the functionality of the system. The issue is twofold. First of all, the cost and whether it's worth what they are asking us to pay. But secondly, getting us away from the bureaucracy of Washington and putting our consumers in a position where they don't have to worry about things being lost, where they can get a decision made here in Nevada as opposed to in Washington. And I think that that's a powerful push, just as powerful, honestly, as the financial side, to get us to rethink our position as what's been called a supported state-based marketplace. So I'm very well aware of those things. But to move on to the second point which you made, there is the potential for collaboration. I've shared with the board that Jim Wadley, who is the CEO of Access Connecticut, which is the Connecticut Exchange, will be coming here to visit with us later this month to talk about ways that we might be able to work together. I have ongoing discussions with friends in Oregon and Colorado and elsewhere. And I will tell you that we are not the only state that is finding this tension, if you will, between trying to be a state-controlled marketplace and the strictures that the federal government would put on us as a result of using their technology and infrastructure. That's problematic. But the other thing that's true, and I was just in Washington actually earlier this week, speaking at a conference, and I was there along with Peter Lee from Covered California. And it's striking how different our exchanges are. You know, Peter got up and said, you know what, we have 1.3 million consumers. I'm one of the largest purchasers of health insurance in the state. So if you want to be on my exchange, you better do what I say. And I'm saying to myself, I got 3 carriers, guys. You know, it's a very different world. It's just a very different world. But what you're finding is that other states, and this has all been in the news, so none of this is new. States like Colorado, states like Minnesota are finding that having standalone technology systems and standalone customer service systems becomes increasingly unaffordable. And that makes a lot of sense. So there are a number of states talking together. We're talking about shared services in terms of technology, call centers, and other things. And I think my friend who runs the Washington Exchange remarked several months ago at a meeting in Portland, you know, the first 2 years, all we did was put out fires. And we were never in a position to sit together and talk about how we might work together to make it better for everyone. That's now the case. Everybody's been able to finally take a deep breath. And so the potential, I think, for collaboration is high. If we find that that is an opportunity and it represents, at least in our opinion, a better opportunity, that could bump it to 2018. There's no question about it. But the point is, there are options out there for us, and the potential for collaboration, I believe, is high.
Valerie Clark, for the record, thank you for that clarification. And by all means, I do recall, you know, the tension that there was in the beginning of when we first opened the exchange, and I would definitely want to be very cognizant of making sure we vetted everything as thoroughly as possible to avoid any complications come implementation time if we were to decide to move. So thank you.
Bruce, and we look forward, as you have noted, that in April we'll have a much more in-depth discussion after you have those meetings. And at that point, we may have a more realistic idea as to whether there'll be a possibility of 2017 period. So,
Yeah, I was going to say,
does
Bruce, for the
anyone
record,
else?
I think that that's a fair assessment. I think that I'll be able to come to you in April and say 2017 looks good, or I think the better course is to push it off to 2018, given what the background is and what we're looking at. So yeah, I would absolutely agree with that.
Does anyone else have any comments or questions on our director's report? Bruce, just because you spent quite a bit of time on this, your report about the logo and the use of the name by various entities, and since the board is actually all present in meeting, and it's possible that some of the board members may actually sign in communications that they are a member of the board, etc. Is that an issue? Maybe our board members would like to know if that is.
Madam Chair, Bruce Gilbert for the record, and thank you for the question. That would not be an issue because your connection and every member of the board's connection with Nevada HealthLink is unquestioned. That would not be an issue. Also, we appear in news articles all the time and those sorts of things. What we're interested in is commercial speech, frankly.
Thank you, Mr. Gilbert. Did I hear any other questions? I would have just mentioned a couple of things. The target, when you mentioned about the target, I'm not going to go into it now, but if I forget, when we get to the zip code parts about the people who signed up, I just wanted to discuss that a little bit further. And I could discuss it here because we talked about, but I comes up when the zip code comes up. So moving on, marketing and outreach overview. Shall we start in the north or?
Yeah, Janelle Davis for the record, communications officer. Sorry, I think that's the loudest I've ever been. So our messaging this year was specifically designed to reach underinsured consumer populations. We continued our outreach efforts throughout the enrollment period to build those relationships. Our media and advertising campaign received positive feedback, and overall coverage was very positive for Nevada HealthLink and the exchange. We will continue to keep a balanced tone with our messaging while working on the off-season campaign and understand the importance of brand awareness even though open enrollment has concluded. The exchange will be collaborating with various stakeholders to work on an off-season campaign in order to reach those underserved and uninsured target populations. We will be focusing on the tribes, rural areas, multicultural entities, Hispanic populations, and the self-employed. We will continue to work to better identify those consumers still uninsured and the best channels on how to reach them. Patty Halbuck from Pen of Powers will provide you with an overview and a recap of the entire campaign and include a detailed report on PR, media, digital advertising, social media, and outreach events, as well as discuss our continued efforts throughout these channels. There will be an appendix available online also if you'd like to see a more detailed report.
Thank you. And we'll continue now here in Henderson.
Thank you. Good afternoon. Patty Halbuck with Pen of Powers. I'm going to, as Janelle mentioned, touch on the highlights from our marketing and outreach overview campaign for you. And also, as Janelle mentioned, there is, in addition to this deck here, there's also another deck containing an appendix with more marketing detail and analytics related to the campaign. It is posted on the website, but if anybody requires a hard copy, we can get that for you. We used a mix of media throughout the campaign. With TV, radio, print, and outdoor, we focused on the number of impressions, which creates our reach and frequency. Impressions means estimated number of people who see and hear our ads. Reach means the number of people within our defined target audiences that we're actually reaching. And frequency equates to the number of times those people within the target audiences actually see or hear the ads. So the goal was the more impressions, the higher the reach and frequency within our target audiences. For TV, radio, print, and outdoor combined, we generated over 112 million impressions during the 14-week enrollment period. This was approximately 4.7 million more impressions than we had originally planned. Some of that is due to the bonuses that we were able to acquire, and some also is due to the allocating more funds in the last January push. We used print primarily to reach the rural areas. We used TV and radio, both mainstream and in the Hispanic niche markets. And we used outdoor digital bulletins in main highway, freeway, thoroughfares, and poster billboards in targeted neighborhoods. We felt this mix of traditional media was relevant and yielded great results. With the political year ongoing, we will strategize and adjust how we use traditional media moving forward to ensure we are as cost-effective as possible. This will also include examining additional ways to reach the underserved and rural communities with more reach and frequency in a more meaningful way, which will include grassroots and more personal outreach tactics within those identified areas. This is something we are currently strategizing with the exchange. We also engaged a postcard direct mail campaign to support brokers and related events throughout the enrollment period. This included mailing to all rural zip codes within the state. Digital and online advertising and social media were both used with excellent results. These two mediums combined yielded over 26 million additional impressions and generated almost 25,000 key actions taking place on NevadaHealthLink.com. Key actions are people who actually clicked a link on and went to NevadaHealthLink.com and took some relevant action on the site, whether it was looking up broker information, using the subsidy calculator, or other information related. Because of their cost effectiveness and the analytic ability to target our specific audiences so distinctly, both digital and social media mediums will likely play a larger role in our next campaign, especially with the challenges generated by the political year with regard to advertising. With PR, we made significant strides, and we created extra exposure for Nevada Health Link. We generated over $9 million in earned PR value. And I'll just define earned PR value as those mentions of either Nevada Health Link or Silver State Health Insurance Exchange that we did not pay for to receive. In the off-season and through next enrollment, PR will continue with the strategy to build and implement a proactive strategic plan that demonstrates a positive public perception and image for Nevada Health Link, strives to maintain a balanced tone of coverage, and measures Nevada Health Link's share of voice statewide. This plan will also include the flexibility needed to react quickly and appropriately to related issues requiring a sense of urgency, as we are directed by the exchange. That's the sum. I didn't go through page by page. There's a lot of analytics and data that you can peruse through. I'd like to turn it over to Janet with the Ramirez Group, who's here to recap outreach for you on behalf of Andres, who's traveling today. And then after, if there are any questions, I'll be happy to answer for you.
Thank you, Patty.
Janet Quintero with Ramirez Group for the record. So for outreach, we attended a total of 63 events throughout open enrollment. We created relationships with 83 exhibitors. This includes potential partnerships in the future and strategic community partners that we can definitely reach out to in the future. In total, we engaged with 56,725 individuals, and we distributed posters and flyers to 292 locations. Again, these are, whether it's public venues or private companies, these are partners that we can reach out to in the future. Some of our observations include outreach efforts helped identify new partners and reach target audiences. New partnerships have been developed with Smiths and Walgreens, and we will engage with them to be even more effective with outreach efforts moving forward. The primary focus of outreach efforts for this enrollment period was on directing consumers to licensed enrollment professionals. And in the off-season, as we gain momentum for the next enrollment period, outreach efforts will also include identifying stakeholders, new strategic partnerships, and identifying areas of underserved populations statewide to engage in grassroots education. So as you know, overall, our strategy consisted of collecting information and forwarding this information to the SHIX portal where brokers were able to access it.
Thank you. Does anyone have any questions? Is that working? Does anyone have any questions on the Marketing and Outreach Overview Report? I would just like to comment that is outstanding with the 56,725 individuals engaged. Do you know how that compared with last year?
Unfortunately, I don't know what the number was last year. I can tell you that number is based on attendance to the events, estimated attendance to the events, but no, I don't have that number.
Thank you. On the appendix, where the information about the zip codes is here, was that something that the PR team did, or is that something that came from our exchange staff, where it has the direct mail coverage and it talked about the zip codes and the number that were enrolled from each zip code?
This was an amalgamation of some preliminary data that we received from the exchange via CMS, broken down by zip code. Penna Powers cross-checked it with our individual lists where we mailed our broker mailings and targeted our advertising to compare those lists against the preliminary CMS data so we could get an initial idea of where the advertising was targeted versus the where the enrollment numbers were coming from. And this is related to direct mail.
I'm sure that you reviewed it. Do you have any summary of your review on it?
With regard to the direct mail, there was a notation in one of the bullet points on the direct mail page in the deck that, interestingly enough, of the zip codes that we mailed specifically statewide to the rural areas, 72% of those zip codes yielded no enrollees compared to where we mailed to. So that is something that we are engaged with the exchange now to ensure moving forward we utilize that data and ensure we're targeting to, as Janelle mentioned as well, additional areas that maybe haven't been identified or need additional resources to engage with.
And that is what struck me. I guess I shouldn't have been surprised, but I was actually quite surprised when I saw many of them were, the first one, 89117, Spring Valley, Summerlin, 2,489. Of course, it makes sense that in this area, these people could probably afford an affordable qualified health plan. But it was a bit disappointing when I saw the other zip codes that I'm familiar with living in Southern Nevada for 30 years with that precise notation you made that no one in those areas selected our plan. Do you think that's because of needing to do more outreach? Do you think that's because the particular, and Bruce, your comments would be appreciated, the particular carriers are not offered in those communities, and those people in many of those, 74 rural areas don't have providers on the exchange, they're not access to providers in that are on our exchange. Do we have any, because it's really amazing. I thought that was very dramatic. Any other comments on that?
Now, Madam Chair, if I may, Bruce Gilbert from the record. One of the things that I think that we learned this go-round that we didn't know previously is that zip code information, while helpful, does have its limitations, and that our outreach and the results that we see are driven by more than the demographic mix in any particular zip code. As we were talking through these things with Penna, it became obvious to us that there are pockets, for example, of self-employed individuals, maybe in zip codes that we weren't anticipating, that allowed us to drive enrollment in those areas. The underserved populations that we're looking at, it's very easy for us to say rural, but what does that really mean? As we know, the groups that find our offerings the most persuasive fall between that 139% and about 250 to 300% of the federal poverty level. And that's before we start talking about the Asian population or the Hispanic population. So really, I think what this shows is over the past 2 years, as a result of our emphasis on rebuilding our brand and going through outreach, we've been able to get an awful lot of the low-hanging fruit, getting those people in and signed up who were actively looking, who I think had pent-up demand for our product. And what we're seeing now is that we have to more actively engage in identifying those groups, not necessarily on a geographic basis, but sort of going through cutting them a bunch of different ways to understand where our additional enrollees will come from. Direct mail, what did we see this year? We saw in the rurals it certainly doesn't work. That's not something we want to repeat. But if you look at the digital and social media, you see some really interesting things. It led to a lot of activity, which is really good. But the other thing is it tells us that the people who were going on there and looking for us and looking at us, they were doing it on weekdays and in the evenings. So you get to a different group depending upon how you message, and we have to figure out what the right mix is, I think, at this point.
Bruce, thank you. Yes, and that's the trickiest one, which is if we only could know how to target the income range, because it's not always, as you say, correlated to zip code. We just knew where everyone was between 138 and 250% and target them. This might sound sort of a bold question. We have now, the IRS has penalized those that did not participate now last year and will undoubtedly continue to do that this year, et cetera, as long as this exists. And I was wondering, but there is, of course, privacy, so we can't find out who those people are, but I wonder if the federal government or the IRS, if there is a possibility that they could notify people who they penalized and tell them that if they're having difficulty buying insurance because they've been penalized, so clearly they haven't been able to purchase it, that they might look into their local exchanges. That probably sounds way too complicated, right?
No, actually, Madam Chair, Bruce Gilbert, for the record, we have been in touch, oddly enough, with the Internal Revenue Service and with CMS to try and find a way to reach those who, in fact, are paying penalties. You pay one way or another. You pay and purchase coverage, or you pay for coverage that you essentially don't have. That's considered federal tax information. It is not made available to the exchange or anybody else. And so there's no easy way or simple way to be able to identify and target those individuals.
Yes, I realize just privacy that we might not be able to do it. I was just wondering if the IRS from their end might be able to notify them of the services available in their state. Maybe you could check it out. Were there any other comments on the report? All righty. This will be one of our briefest meetings, I think. Discussion and possible action regarding dates, times, and agenda items for the future. Is there anyone that has any suggestions or comments? Quiet? Everybody's so quiet today. How about in the north? Do we have any public comments at this time?
There's none in the north, Madam Chair.
And any public comments here in Henderson? Seeing none, I would call for adjournment. Everybody, thank you so much for coming and for your time and efforts. So appreciated. Have a wonderful afternoon.
Thank you. The IRS is so interested in working with the state of Nevada, let me tell you.